In today's speech, I will be informing you about the tragic forgetting disease known as Alzheimer's. I will be doing this by first explaining to you what Alzheimer's disease is, second by explaining the risks, symptoms, stages, tests, treatments, and preventions, and lastly by explaining the care needed for someone who has been diagnosed with Alzheimer's disease. According to Alzheimer's Disease Association, 10% or 1 out of every 10 people at the age of 65 are diagnosed with Alzheimer's disease. Think of your favorite memory. Now it's gone, and you cannot remember anything about it. Unfortunately for some, this is a reality. Alzheimer's disease is named after Dr. Alois Alzheimer, who in 1906 noticed a change in the brain tissue of a woman who had been diagnosed with an unusual mental illness. Her symptoms included memory loss, language problems, and unpredictable behavior. He examined her brain further and noticed that she had abnormal clumps and tangled bundles of fibers in her brain. This was just the beginning of the Alzheimer's disease journey. Alzheimer's disease affects memory and other mental functions. According to UCLA Health, Alzheimer's disease causes degeneration of the brain tissue and nerve cells. With less nerve cells present, it is harder for the brain to function properly and work with the body. Alzheimer's disease is also known as AD, which is a progressive form of dementia. The medical definition of Alzheimer's disease is the medical deterioration that can occur in middle or old age due to generalized degeneration of the brain. There are many risks for people who have a chance of getting Alzheimer's disease. Some include age, family history, genetics, gender, past head trauma, lifestyle, and heart health. Your head and your heart are connected, and this makes sense because your brain is nourished by one of the body's richest networks of blood vessels, and your heart is responsible for pumping blood through these blood vessels to the brain. Meaning that if you have heart issues such as heart disease, diabetes, or high blood pressure, you are more at risk for getting AD. Everyone forgets things now and then, like where your favorite shirt is or even where your keys are. But unfortunately for some, they forget things forever, things that they thought were unforgettable, like their daughter's 16th birthday and the wedding of their best friend. There are many symptoms of AD. Forgetting is one, but there are many more. If you have a loved one who repeats questions or conversations, misplaces personal belongings, or gets lost on a familiar route, they may be at risk for AD. According to Healthline, reviewed by Timothy J. Legg, a board-certified psychiatric mental health nurse practitioner and licensed psychologist, other symptoms include decreased judgment, trouble with speech and writing, mood and personality changes, and becoming disorientated about times and places. AD is a serious disease that shaves away years of love and memories that many cherish. According to Healthline, Alzheimer's disease has 7 stages, each getting worse than the last and taking more away from the brain. Stage 1, there are no symptoms, but if there's family history, there may be early diagnosis. Stage 2, they seem to forget simple things like where their keys are. Stage 3, physical and mental impairments are noticed by a loved one. Stage 4 is normally the stage that AD is diagnosed. Symptoms include memory loss and inability to do everyday tasks. Stage 5, the loved one needs to contribute more to the ill. Stage 6, they continue to go in a downward spiral and need help eating and changing. Stage 7, the last stage and the worst stage. They continue to lose their memory, and they lose their ability to talk and even use facial expressions. Unfortunately, there is no specific test to diagnose AD, but there are mental, physical, neurological, and imaging exams that can be done by your doctors to help them diagnose you. Doctors may ask you questions like, what day is it, or who is the president, and they may also ask you to repeat a short list of words. In a physical exam, they may take your blood pressure, heart rate, and temperature. In a neurological exam, they may test your reflexes, muscle tone, and speech. And in some cases, they may order MRIs or CTs. But in many cases, loved ones notice the deterioration in health and mental functions and advise them to go to the doctor. Like there are no tests, there is also no cure for Alzheimer's disease. However, there are medications and change in lifestyle that may benefit them. Tacrin is the medicine used to reduce the symptoms of AD and in some cases, improve thinking ability. Melinda Smith, Lawrence Robinson, and Jan Siegel came up with the 6 pillars of Alzheimer's disease prevention, which are regular exercise, social engagement, healthy diet, mental stimulation, quality of sleep, and stress management. Still, these do not for sure get rid of Alzheimer's disease. As scary as it sounds, there is also no for sure prevention of the forgetting disease. According to researchers, healthy lifestyles can be adapted to decrease your risk of getting AD. Some that might help include no smoking, regular exercise, and eating healthy, and so on. When a loved one is diagnosed with Alzheimer's disease, it feels like they're already gone and their body is here trying to remember the life that they once lived. It is just as hard for the loved one as it is for the person who is diagnosed. But as hard as it is, they need to provide care for the one that is diagnosed. They need to be patient and work with them no matter how frustrating it is to repeat themselves. According to Mayo Clinic, there are many ways to keep a safe and supportive environment. For those diagnosed, establishing and strengthening routine habits and minimizing memory-demanding tasks can make their life much easier. Some steps include keeping photos and other meaningful objects around the house, using a calendar or whiteboard to track daily schedules, building a habit of checking off completed items to be sure that they were done, and installing sturdy handrails on stairways and in bathrooms. Having photos of family members around the house will allow the person to remember the people and the events that have happened. Using a calendar will help them remember what has been done and what needs to be done, and installing handrails will ensure that they stay safe from falls and injuring themselves. If you are a caregiver, you can help yourself by learning as much about ADD as possible by asking questions of doctors, social workers, and others involved in the care of your loved one, calling on friends or family members for help when you need it, taking a break every day, spending time with your friends, and taking care of your health by eating and exercising. Taking care of a loved one with Alzheimer's will add additional stress to your life and possibly decrease your nutrition because you will be focused on theirs. No matter how overwhelming it becomes, it will be very rewarding because you will become a part of their life that they need most. Today, I informed you of the tragic forgetting disease known as Alzheimer's. I did this by first explaining to you what Alzheimer's disease is, second, by explaining the risks, symptoms, stages, tests, treatments, and preventions, and lastly, by explaining the care needed for someone who has been diagnosed with Alzheimer's disease. Memories that are forever cherished by many become easily forgotten by some. This breaks many hearts of loved ones who have family members diagnosed with Alzheimer's disease. Remember to cherish all that you can before the unforgettable becomes the forgotten.